Whenever you miss your periods, then we know that, okay, there is something wrong. And then you can take a home pregnancy kits. There are many pregnancy kits that are available in the markets or over the counter. So you can order any home pregnancy kit and you can do you can test your urine for that. So it's usually test the hormone beta HCG in your urine. So whenever you miss your period or after a couple of days after missing your period, this test can be performed and it's usually good. Like it has very low false negative results. And the other way is if some women test this and if it's negative or some false negative results, then they can visit their doctor, the gynecologist, where the gynecologist advises a blood test. So it's more accurate and more confirmatory, almost 100% confirmatory, and it finds out whether you are pregnant or not. So we call it beta HCG test for blood for pregnancy. So these are the two ways where you can find out whether you are pregnant or not. It's always advisable to consult your doctor before 8 weeks of pregnancy. Like once you miss your period, please visit your doctor because there are many conditions, many risk factors, many things that a doctor checks and lets you know whether it's in the normal range, whether you're pregnant, whether the pregnancy is going on fine, how to track your pregnancy, what all tests needs to be done in the early stages, and how to take care of yourself and your baby. So all these things needs to be discussed. So it's always better that please visit your doctor before miss your period or once you have tested positive for further treatment and further plan. We always say, and everybody knows that we should be having a healthy pregnancy diet. Now, what is that healthy pregnancy diet? So normally we advise extra 300 calories of diet during pregnancy so that the woman puts on adequate amount of weight and the baby grows and develops properly. So that diet includes like proper amount of proteins. It should have proteins in its diet. She should have low amount of carbohydrates or sugars and salt and low amount of saturated fats. So it should include vegetables, it should include fruits, whole grains, lean meat and poultry, fish and eggs for non-vegetarians, and pasteurized milk or pasteurized milk products. So this is something, and it should be taken in proportion. So these are the diet that a woman should follow. And there are certain things which we don't advise to take during pregnancy. So which is a complete no-no is smoking. That's a complete no-no. And drinking in any form, like any alcohol, is it's not healthy during pregnancy. Caffeine and tea intake should be limited, should be taken in moderation. And non-veg, like for non-vegetarians, the meat should be properly cooked. There should be no raw meat consumption during pregnancy. So it's not advisable to have raw fish or sushi during pregnancy. And milk products should be pasteurized. Milk products can be used. Otherwise, unpasteurized milk products is a complete no-no. So you can have soft cheeses, but no hard cheeses. Like you can have cheddar and mozzarella, but no brie and feta. So these are something which broadly I can recollect that it should be avoided. Complications during pregnancy. So pregnancy has its early pregnancy and late pregnancy. During early pregnancy, any bleeding or abortion, incomplete abortion, missed abortion, or any threatened abortion, this is one of the commonest complications. And ectopic pregnancy, where pregnancy is situated in abnormal location apart from the uterine cavity. It may be inside the tubes or inside the ovary or inside your abdominal cavity. So when it's an unwanted one. So these are the complications, and it's a medical emergency. So these are the complications in the early phase of pregnancy. And usually after 20 weeks, there can be bleeding, abnormal bleeding patterns, which we call placenta previa, when the placenta is situated low down in the uterus, or abruption, placental abruption, when the placenta gets separated from the uterus. So this becomes medical emergency, obstetrical emergency, where there is risk to the baby also. And then again, there may be gestational diabetes, we call it, where the blood sugar level rises. And it's usually after 20 weeks, we call it gestational. And then there can be high blood pressure, which we call pregnancy-induced hypertension. And that may also, if uncontrolled or if in its severe form, it can lead to fits, which call eclampsia and preeclampsia. So it becomes another emergency. And then there can be preterm labor, there can be infections, there can be abnormally high Liker or low Liker. There can be intrauterine growth retardations, like abnormal growth of the baby. So these are the problems that one can face during pregnancy. And this can be very well avoided if one is under regular antenatal care. Then the doctor keeps on regularly checking and performs certain tests which are required during pregnancy. So these can be identified at an early stage also when the problems are cropping up. And it can be very well be taken care of, and the baby and mother both can be monitored so that the results lead to a healthy delivery or healthy baby and healthy mother. And the delivery modes of delivery can be discussed with the doctor. Depending upon the severity of the complications, the doctor takes a call whether to allow for a normal delivery or to go for cesarean sections. So this is totally dependent on the condition of the mother, condition of the baby, and the situation at that point of time. So doctor takes the call. The newborn baby, see, as soon as the baby is born, the cord is clamped, and the baby, if it's a normal delivery and the baby's Apgar score, normally the pediatrician checks for the Apgar score, like the vital parameters are checked of the babies. And it's done at 1 minute and after 5 minutes. And if the Apgar score is normal, then the baby is usually considered as normal. So when we are not expecting any problem and the normal delivery has happened, the baby is put immediately onto the chest, onto the abdomen of the mother, so that the mother and baby can have a bonding, and even they can initiate breastfeeding also at that point of time. And otherwise, so after that, the pediatrician takes the baby for a quick routine examination. The babies are examined. And if they feel that everything is fine, the baby is swaddled to maintain the temperature, because they can't maintain their own body temperature. So we have to protect them from hypothermia. So they're swaddled up, and then the baby is taken to the nursery for a detailed examination. Meanwhile, the mother, like if she has delivered normally, if there are any cuts or episiotomies, then the gynecologist sutures them. And once everything is done, mother is shifted to the room, and the baby is fine. And after the detailed examination, if the pediatrician feels the baby is okay to be allowed to be with the mother, then the baby is also shifted to the mother. And then the mother can initiate breastfeeding, and it helps establishing a special bond between the mother and the child. And if in case of like gestational diabetes or some other complications with the mother, then the babies are monitored. They are kept in the nursery for a few more hours. They're checked for their sugars, they're checked for the respiration and everything. And if there is any problem, then it's taken care of. Otherwise, the babies are handed over to the mothers. Well, this is an important period for the woman. Like during labor, it's very difficult time for her, and it normally the relatives or usually the husbands are allowed to be there in the labor rooms, and we doctors are always there, and the staffs, the nursing staff and the junior doctors, everybody is there to take care of the women. So nowadays, like if she's going through pain and if she can't handle her pain, there are options of painless labor, which a woman can ask at any point of time. And we keep visiting her. We as doctors, we keep visiting, we keep monitoring the baby and the mother, the vitals, the baby's heartbeat, everything is monitored. And at regular intervals, depending upon her progress, we keep checking her for internal examinations and on how the labor is progressing. We keep counseling the women also. So that is how she's prepared for her labor part also. During labor, we help in pushing and everything. And to shorten the second stage of labor, sometimes we use vacuums or forceps, or we give episiotomies, like cut in the vagina to facilitate the delivery or shorten the second stage of labor. So this is how we take care of a woman during the labor period. Post-delivery, it's another very challenging period because although it's very exciting for the women, but the things are actually not as smooth as they expect it to be. Like sleepless nights, breastfeeding is another challenge to handle your baby, like change the nappies, and even the mother needs rest and sleep, which is very difficult. So we advise the women to have sleep whenever the baby sleeps. Otherwise, they have no time for that. So it's recommended that whenever your baby sleeps, please have some rest. And then she also needs assistance with breastfeeding and all, because that is something very new to the mother. And both the baby and the mother, they are new to the process. So it takes some time to establish. A mother feels very frustrating if she's not able to breastfeed. So there are lactation consultants who help them, and we as a gynecologist, we help them. We teach them how to position the baby, how to sit comfortably and then feed. Otherwise, it leads to many positioning, back pains and all. So this is how a woman is taken care of. And another thing is postpartum blues, which is very common. So even that becomes an important thing, because if postpartum blues continue for a longer period of time, then you have to be sure that, okay, whether the woman is progressing into depression or something, that needs to be tackled. So these are the things which needs to be taken care of immediately after delivery. To ensure a healthy pregnancy and a healthy baby, a woman should take care of her health first. She should be exercising normally if there are no contraindications and if the doctor allows. Then she should be doing a moderate amount of exercise every day. She should be taking a healthy diet. She should take care of your diet. She should avoid unnecessary food or unnecessary calories, which puts on just a lot of weight, and then abnormal weight gain has its own problems during pregnancy and labor. So she should avoid that. A woman should not take any medications or anything without consulting her doctor. And she should go for her regular antenatal visits, because those visits are important, because any abnormal thing coming up or any medical condition or anything that gets picked up only during these visits. And certain investigations are recommended at a particular period of time. So the doctor does that and finds out if something comes up, that gets treated, picked up and treated. So antenatal visits are a must, and it should not be missed. Moreover, there are certain vaccinations which are given during pregnancy. So those are advised by the gynecologist only during her visits, so she can take them. So this is something very vital. So she should just listen to her doctor, do her part sincerely, taking care of her diet, exercise, etc., and do her regular antenatal visits and follows her doctor's advice. That is the key to have a healthy baby. This is, as a pregnancy care, it's fine, but before getting pregnant, also, there are certain things that a woman should do so as to ensure a healthy pregnancy. Nowadays, pre-conception counseling is done, and every woman should be aware of that. Before planning, she should consult her doctor so that her deficiencies can be picked up. If she's deficient in something, we can replenish that. If she needs some vaccinations like German measles or chickenpox or hepatitis B, she can be vaccinated before her pregnancy. And so there are certain routine blood tests. Her thalassemia screening should be done. So these are certain tests which are advised before pregnancy. And once these tests are done, if she needs something, it's given to her, and she's advised some medications. If any medical abnormalities or medical conditions are picked up, she's advised. So in nutshell, she conceives in the best environment, like in her best of her health. So this is something which is very important. And if she has any medical problems or any like diabetes diabetes or high blood pressure, then it becomes a high-risk pregnancy. So the pregnancy visits becomes more frequent. The doctor will call her more frequently than a low-risk woman. So this is something which is important, and it needs to be done before planning any pregnancy.